How to splint a small dog with a fractured radius ulna. She is starting by applying stirrups to the medial and lateral surface of the limb, never over the pad. Normally when we start a bandage, we'll start at the toes and work up, but because we're pretending that there's a fracture in the distal radius, she is starting the bandage at the level of the fracture. The faster you get that fracture under bandage, the more comfortable the patient will be. She then takes it down to the toes, and we're going to go back up to the elbow, but we're going to exclude the elbow. So clearly she has started with the cast padding, and this is 2-inch cast padding, and she's used about half a roll. She's going to follow that with the compressive layer or the cling, and again she started over the fracture, but she doesn't start compressing until she is distal over the toes, and she's going to compress upwards. When there's a fracture, compression over the fracture can be quite painful, so maybe go slowly and compress less on that first turn and a little bit more on the second turn. The stirrups, which we're going to get trimmed up, are then taped to the cling itself. We're going to cut a tongue depressor to the appropriate length, and in some dogs, a little bit bigger, you may want to use 2 because these are pretty flimsy, and then just tape them together. Because this is a fracture in the distal radius ulna, we can apply the splint below the elbow, so we're not going to immobilize the elbow. And we'll take it all the way down to the toes. I do that at the beginning of the fracture healing process, but once we're maybe 4 weeks in, depending on the age of the dog, I might make that splint a little bit smaller so they can actually walk on the paw. Jen is just taping the splint back in place with some white tape, and she likes to use the cling to help hold it in place. So notice how she has picked up the bottom of the splint in that first roll of the cling, and it's just there to hold the splint in place. The next layer will be the protective layer, or the Vetwrap, and 2 inches is usually the shortest we have, which tends to be big. So Jen just pulled a strip of the 2-inch, folded it back and forth, and now is cutting it in 2, which gives her 2 strips of 1-inch Vetwrap. She'll then take that strip and make a little roll out of it, which makes the whole thing just more manageable and easier to apply to the limb. The Vetwrap is then applied as the final layer, the protective layer, to the bandage itself, and just starting at the toes and working her way up, ensuring that she cradles the tip of the splint as well, just to further help hold it in place. If you haven't done so already, be sure to watch the other bandaging seminars in this series, which will explain to you what all the different layers are, exactly what order they should be applied, and we'll give you more tips on how to apply them. The most important one is follow up and getting the owner to be compliant. So don't forget to watch that one too.